Afternoon, everybody. Just give it a few more seconds. Okay, well, I think I'll make a start. So afternoon, everyone. Hope people are well. As always, keen to hear from yourselves. So important to give you just a few updates from my perspective. But yeah, purpose of these sessions really is as well to hear from you. And I hope Chris or Chloe, I think actually it's Chloe today, isn't she? Joining us, Chloe. If you can just keep an eye on the chat, etc. So yeah, as always, a few updates, and then I'll hand over for questions. So a couple of things basically around most of the updates today around IPC. A couple of changes there which I just want to touch on. But first thing I just want to mention is people are probably aware Sunday is sort of the National Thank You Day. And people, I'm hoping, will have seen in comms an opportunity for individuals to thank either colleagues or teams, etc., that you work with. So please do. We're hoping to do some social media, etc., over the Jubilee weekend. So please do take part. Opportunity, isn't it? Although I'm sure we thank our teams and colleagues on a daily basis, but it's a really good opportunity to show our gratitude to our teams. So a couple of things then from an IPC perspective. First one I just want to call out is, again, we've mentioned it in various forums and briefings following the MRSA outbreak that we had in the summer. And I've given previous updates which still stand, some fantastic improvements across the trust. We had an NHSEI inspection sort of review a fair few weeks ago now, which we've received written feedback on that, and again significant. They called out some significant improvements that they saw on that visit. Still areas that require some improvement, but pleased to say majority of that feedback we're aware of and is incorporated into the trust's improvement plan. But really good to get that external assurances around the improvement. So previously as well, I mentioned, and some of you may have met Jacqueline Barnes, who's working with us to support us in them improvements as an NHSEI improvement director. I spoke previously of the significance of it and the severity of it. And over certainly the last couple of weeks, we've been meeting with NHSEI around the additional scrutiny, assurances they require, that we as an organisation know what our issues are and have plans in place to not only improve but to embed and sustain them changes. So off the back of that, we've now had formal acknowledgement that we've been moved from what NHSEI call their strategic oversight framework. So it's where they put trusts depending on any issues, concerns, risks. So we were in level 2. We've now been moved into a level 3 from a strategic oversight framework. A level 4 is what the system is in. So systems as well as separate organisations get sort of rated. The system is in a level 4 due to the quality, safety and financial issues across the system. But now as an individual trust, we've moved from a 2 to a 3. For yourselves, I don't want people to get concerned or worried around that. The focus has to be the improvement work from an IPC perspective that we've set out to do. There has been some significant, as I've said, just significant improvements, not just in our estate, some of our processes, our governance and oversight, but there is still work to do. But I just wanted to update really where we are. We'll issue a staff sort of briefing. I think Chloe's got that lined up probably to go out tomorrow as well. That just gives a bit more detail into some of the improvements that we've achieved to date, but also as well around what SOF 3, Strategic Oversight Framework 3, means really for the trust. But predominantly that's for us around the meetings, scrutiny, reports that we have to do externally as well as internally. So that's it just from that perspective. But please, as I say, take away the brilliant work, both estate and process, and really positive to say that there was sort of 6 must-do actions that NHSEI called out after their initial review in February. All of them have now been completed. So and as well a large proportion of the improvement plan, if not complete, it's well on its way to be completed. And then the other thing really I just wanted to touch on, which I can see Sarah's joined, so I'm grateful for that, is just around some of the changes. We've spoke previously around the IPC, the COVID IPC guidance. So just wanted an opportunity really, Sarah, to join really just to update everybody around where we are, what changes have we made, and what are the work we're looking at the moment. So Sarah, are you happy to come in?
Yeah, thanks, Stacey. And I'm sure you've all seen the comms that have been circulated, but the main things to communicate today are about our physical distancing and face masks, because there are some key changes there. So we're remaining at 2 metres in our ward and department areas, and obviously continue to wear face masks. We are reducing to 1 metres in our outpatient departments across the site, but again, patients and staff to remain wearing face masks. Break spaces in local departments, we're asking you to continue to maintain 2 metres where possible, because you are taking your mask off to eat and drink. However, we are moving Denbies to 1 metres to increase the capacity there, and that's because there's good ventilation and that's been risk assessed. So that should help in terms of the amount of space available to staff. Our training, if you're clinical training, so manual handling, resus training, we're asking you to continue to wear masks because of the proximity that you'll be in. But for things like interviews, lectures, face-to-face meetings where you can remain 2 metres apart and there is adequate ventilation, we are now saying that if you remain seated and 2 metres apart, you can have those meetings or lectures without a face mask. We'll obviously keep it under regular review, but that's the position statement as we speak. There will be some more comms coming out in terms of the patient pathways. So we're moving from red, amber and green to respiratory and non-respiratory. Some of our ward and departmental managers have been briefed on that and what that means, but we will circulate comms more widely to that effect as well. I'm pleased to say that we've moved to lateral flow testing for our pre-surgical admissions, and that process is in place. So that's a good move forward. Still further work to do with our inpatient testing. And lastly, for me, it's just to remind staff to continue to test twice weekly with your lateral flow tests, and obviously not attend work if you have got respiratory symptoms. Really important, because although COVID prevalence is down, it is still out there. But yeah, happy to take any questions.
Brilliant, thanks, Sarah. And off the back of the twice weekly, yeah, as well as do it, please report it, because we are monitored as well from a reporting perspective. So please do continue to log your result as well as undertake the test. That was it really from updates today. Quite short. Chloe, anything that I've missed? Some of that is because I've just had a week off. And yeah, first day back yesterday, so still catching up.
We've had a question from Chloe Upton in the chat about the social distancing and mask wearing updates. So she is asking why there's so many variations of distancing and mask wearing. What's the difference of me having a meeting with a colleague 2 meters apart without a mask to sitting at my desk in a shared office at 2 meters apart?
It's a good question. We took the poll into consideration because we did ask staff their opinion and thoughts. However, there are lots of office and non-clinical spaces within clinical areas. So I use therapies as an example. There's some office spaces within there. There's also, we're trying to get as many people back to work at the hospital, and space is obviously a premium. So we're asking people to sit 1 meter apart so we can bring people back onto site. And those meetings that you might have for 1 hour a day, face to face, your exposure in terms of the prolonged exposure without a mask is limited, so the risk is much less. Whereas if we opened it up to all office spaces in non-clinical areas, we think there might still be that risk of you know, communicable disease. So that's our rationale. I hope that makes sense, but as I said, we'll keep it under regular review.
Thanks, Sarah.
Thank you. Sarah Owen has asked, where does sitting in an office with other people, sometimes only one person, mean for wearing a mask and social distancing? And I think, like you said, it's 2 meters apart and mask still, isn't it?
Yeah, it's for all office spaces that are more than one person. We're asking 1 meters and masks at the minute, just for consistency and continuity over the site. As I said, we will be reassessing regularly, but we're trying to keep the messaging quite simple. And we ask that staff respect that and continue to wear masks in those non-clinical offices, please.
I think, yeah, it's a step change, isn't it? And we need an opportunity to review, see what happens. I'm sure there'll be more guidance that comes out. It's interestingly yesterday, well, last night, my phone was going mental on one of the chief exec WhatsApp groups, where a lot of trusts are being contacted from various people and these groups that have been formed, very anti-COVID, around face masks in hospitals. So there's a lot out there, and we heard, was it Wales, I think, are talking about, aren't they? Again, no face masks. So I'm sure there will be further guidance to come, but this is a step change and it's better than what we'd currently got. So it's about doing it safely. I think the other thing as well is if we look at the outbreaks that we had within the trust and where they happened, again, predominantly in staff rest areas, Sarah, wasn't it? Office areas. So again, it's trying to learn some of our hotspots from the outbreaks that we had across the trust as well. So I think this is a step change. There may be more changes to come, but let's at least see how this goes and give us opportunity to review. Because the other thing is, it's the ventilation that's key. Which is great now. We're approaching hopefully some warmer weather and windows will be open, etc. So, but it's not just the distancing and the face mask; it's also the ventilation in the area that you're in as well. That's key. Anything else in the chat, Chloe?
Still on face masks and distancing. So Kim Byers is saying that, so she sits in an office where they're all 2 meters apart, no one works from home, so obviously no one else will be returning to that environment. We have to wear masks according to guidance, but for example, they could meet up together in the evening, go for a walk, whatever that may be. And she's basically asking, could non-clinical offices be individually assessed maybe? I've just seen Sarah's reply in the chat.
Yeah, so that is something that we're looking to and part of the regular review. But as it stands at the moment, we're asking all office spaces with multiple occupancy to kind of 1 meter with masks. But as Stacey said, it's the ventilation that's important, and how do we regularly keep those under review? How do we check compliance, etc. So there's a big piece of work in terms of those individual office risk assessments that Ian Gingle is helping us with.
Yeah. And I think again it's a good question As we know, outside of hospitals, it's a very different picture. But again, just to touch on the guidance, still describes face masks in hospitals. So therefore, we have to factor that in. It's different to just the general population in the world outside of hospitals. So I think this is a risk-based approach that we're following, and we're trying to compromise on some of that for staff, because we all know now we don't have to wear masks as much outside. I certainly would prefer not to wear a mask, but it's not really a hardship to wear a mask. So I think there's a compromise there, isn't there, at the moment? Anything else, Chloe?
Sandra Kank is asking, will meeting rooms be reassessed for numbers?
Yes. Yeah.
It's part of the work that, isn't it, Ian's doing for us, and we're looking around. Some of the office space that we repurpose for other. So Craig Macbeth is leading that piece of work for us from a trust-wide perspective. So we need to get back to some normality. We may need to keep some changes in, and I've spoke about previously, as much as we want to encourage people back on site, we don't want to lose sight of flexible working, and for some people working from home or occasional working from home suits. So I don't want to be dictating to people what they need to do, because there needs to be flexibility within it. But what I do need to do is enable staff that want to be on site to be able to come and work on site. So that's sort of the approach that we're taking.
Thank you both. Nothing else in the chat at the moment. I was just thinking, Sarah, is it worth doing a reminder around the uniform comms that we put out a couple of weeks ago?
Yeah, thanks. Thank you. So we've just asked staff just to be mindful of coming into work and getting changed at work, so not coming in their uniform and not going home in their uniform, please. So we've asked for that message to be spread widely amongst your teams. We are reviewing our uniform policy, and there will be some key changes. So we have got comms plan lined up for that. So Richard Potter, one of our clinical chairs, and Rachel Flood are working on that with staff engagement at the moment, predominantly in relation to theatre attire, and kind of where you can wear theatre attire. So look out for that in the coming week or so.
Perfect, thanks, Sarah. And I suppose another big change is probably the changes to car parking prices for patients and visitors, Stacey. So I don't know if you wanted to touch on that briefly, just to let staff know.
Yeah, thanks, Chloe. And again, difficult decision, but we hadn't reviewed car parking charges for this is for patients, so this isn't around staff. From a patient perspective, for I think it was over 5 years, and did a bit of work around benchmarking across other sort of locally, Oswestry, the council, but also other trusts, local trusts and trusts within the system. So made the uncomfortable but needed decision to increase, I think it's by 50 pence, isn't it, Chloe, I think, which again still brings us well under, as I say, what the local car parks are charging and what other trusts are charging as well. So it is a minimal increase, although with the economy at the moment and things are stretched, it was a difficult decision to make. So that, I think it comes into, I think it's June, isn't it? I think we've started putting some of the posters up on the pay meters, etc., in the car park to pre-warn patients around that. But again, things like the weekly tickets that we offer and stuff, there's no increase in charges there. We're hoping it will be okay received, but yeah, it wasn't an easy decision to make, but it was a necessary one, unfortunately.
Thanks, Stacey. Just to say as well, I was working with Sian Langford on the comms, which has gone in today's notice boards, and we popped some bits on the external trust website as well. We're just asking departments and managers to kind of review any literature they may send out to patients themselves, which may have any reference to charges on, just to make sure it's up to date. So the trust website, external trust website, is where you can get the most up-to-date information. So it's just under patients and visitors and getting to us if anyone does need it.
Great, thanks, Chloe.
And I think that's everything at the moment, unless you or Sarah have got anything else you'd like to raise.
No, it's just if anybody's got anything, anybody wants to pop their hand up who haven't used the chat. No. Okay, I think we'll call it a day. So thank you everyone, and I hope going into a nice long bank holiday weekend. So I hope people who aren't working get some downtime, and a huge thank you to those that are working, certainly over the bank holiday. So, and as always, huge thank you. It's still really busy. It will continue to be whilst we need to get through this backlog of patients that require our care and treatment. So huge gratitude and thanks certainly from me and the senior team. So appreciate all the hard work and everything everybody's doing. So have a good weekend all. Take care. Thanks.